for that nice introduction and welcome everyone. Thank you for getting up so early on a Saturday to be at this amazing event. I want to thank Toya for continuing to bring this educational conferences to all of us virtually. For now, we'll be in person soon. So let me go over really quick what I'm going to share with you this morning. And this is a brief synopsis of what I'm going to be talking about. Um, what you will learn today, or a refresher for those of you who may have heard me before, I'm going to talk about Medicare and Medi-Cal today, how they work today. I'm going to talk the different healthcare options that you have under the Coordinated Care Initiative. As you see on your screen, we're going to talk about CalMedi Connect and who can join, what the benefits are, the care coordination, which is the heart of the program, how you can continue to see your doctors while you're enrolled in this program, and the available plans under CalMedi Connect. We're also going to talk about two other options. Even though you may have Medicare and Medi-Cal, you may choose not to enroll in CalMedi Connect, and that's fine. So we're going to talk about the Medi-Cal Managed Care Plan, the benefits and the available plans in the counties where this program is being implemented. And finally, the other option is the PACE option. I'll go into a little bit more detail later on, but we're also going to talk about the benefits and the available plans. Medicare and Medi-Cal today, two phenomenal programs, very rich in benefits on their own. And unfortunately, they don't work. They don't talk to each other to no fault of anyone. You know, we have under Medicare, it's for people that are 65 years of age and older, of course, and with certain people with certain disabilities. And Medicare covers primarily your doctors, your hospitals, your prescription drugs. And then we have Medi-Cal. Medi-Cal is for those Californians who meet income requirements. So it is income based, and it primarily covers the long-term services and supports, and all those acronyms that you see on your screen. We'll talk a little bit in detail later on in the presentation, but it also covers nursing facilities and non-emergency medical transportation. Um, it covers durable medical equipment, and it acts as a cost sharing plan. So we have Medicare and Medi-Cal not talking together. So what happened? The federal government and the state government came together and put together this plan, CalMedi Connect, that brings all the benefits of Medicare and the benefits of Medi-Cal into one plan, and that is CalMedi Connect. You must choose to join one of these options that you see on your screen if you haven't already, to continue to receive your Medi-Cal services. So what is CalMedi Connect? It's a different kind of plan. It combines, as I said earlier, all your Medicare and Medi-Cal benefits into a single plan. But the heart of the program is the care coordination that you get. So you have the choice when you enroll in CalMedi Connect to also be assigned a care coordinator. It's like a personal social worker, if you will. And this person is either a nurse or other healthcare professional who helps you get all the services that you need under Medicare and Medi-Cal into CalMedi Connect. It makes things easier. It makes it easier to navigate the very complicated system that we have. You only are given one ID card. So instead of carrying both your Medicare and your Medi-Cal card, you only carry the CalMedi Connect card with one phone number. You also get additional vision benefits. And depending on the plan that you enroll with, CalMedi Connect, some plans offer extra benefits for vision. You already have, if you have Medi-Cal, you have unlimited transportation benefits for healthcare related services only. And then some plans, again, depending on the plan and the county that you're in, you may also get additional dental benefits. And you get a home and community-based services that you need once you enroll in CalMedi Connect. This program has been in existence for almost 7 years. It's only being implemented in 7 counties in California, so unfortunately it's not everywhere. It's in Southern California. The plan is being implemented in Los Angeles, Orange, Riverside, San Bernardino, and San Diego counties, which is where this conference is focusing on. So I'll share more information on the health plans that are on the network as it relates to those specific counties. And then up north, the program is offered in San Mateo and Santa Clara. There are no extra costs associated with joining Account MediConnect in any of these counties. Here are some of the benefits at a glance that you get when you enroll in Cal MediConnect. Getting care is simplified with Cal MediConnect. You get all the questions answers that you all the questions that you may have answer when you dial that phone number on the ID card. Um, you get access to your doctors, hospitals, therapy services. As I mentioned earlier, you may get additional dental benefits depending on the plan, prescription drugs, language services. If the plan doesn't have an in-person that speaks your language, they do have access to language services. And of course, your long-term services and supports are also included in CalMedi Connect. And I love this slide that you see on your screen. This is one of my favorite slides because it really brings together what I'm talking about. This CalMedi Connect is very patient-centered. And the little person in the middle of that circle, it's you, or it's our loved one, the person that enrolls in the program. And the person holding that little piece of the puzzle is the care coordinator that I talked to you about earlier. If you enroll in CalMedi Connect, you have access to a personal care coordinator. And this person is the one that really communicates and it brings all the puzzle together for the benefit of you, the beneficiary, the patient, or loved one, and connects the hospitals, the doctors, the pharmacy, all these specialists, all these healthcare providers communicate with each other through the care coordination for your benefit. So really the care coordination is what I call the heart of the program of CalMedi Connect. I'll share with you briefly care coordination in action. So as you see on your screen, we have Mr. Sanchez. Mr. Sanchez recently had a stroke and it's living at home. So before CalMedi Connect, Mr. Sanchez would have to navigate the Medicare, Medi-Cal, and other county agencies to get the care and the services he needs, um, relying ultimately on their doctor staff for help. You know, coming to the doctor, I received this envelope. Can you please help me? And so with CalMedi Connect, Mr. Sanchez now has a care coordinator. And this care coordinator is the one that communicates with all these doctors, the pharmacists, and providers to make sure that everybody is on the same page. And this care coordinator arranges all follow-up visits, transportation, services that Mr. Sanchez may need. Um, Based on his needs. The care coordinator also helps Mr. Sanchez make follow-up appointments, obtain authorizations, and check to make sure that his medicine is ready at the pharmacy. And if Mr. Sanchez needs transportation to go pick up his medication, the care coordinator can do that as well. So this is a very important slide. Keeping your doctor. So you want to join CalMedi Connect, but you want to make sure that your doctor is part of the network of CalMedi Connect. But what if, so if your doctors are part of CalMedi Connect, then, you know, make sure that they're on the same plan that you want to choose. And I'll share the different plans that are in the network shortly. So that you can continue to keep that same doctor that is part of the network. But what if your doctor is not in the network of CalMedi Connect? That's okay, it's not the end of the world. You can enroll in CalMedi Connect, excuse me. You can enroll in CalMedi Connect and continue to see your doctors for a period of time. Well, what does that mean? A period of time is up to 12 months. So what happens in those 12 months? The health plan, it's in constant communication with your doctor to see if they can come to an agreement so that the doctor can join the network and you can continue to stay in the program with your doctor. At the end of the period of 12 months, if your doctor chose not to be part of the network, then you have to make a decision and your care coordinator can help you. Either if you want to keep seeing your doctor, then you disenroll from CalMedi Connect. But if you like the program so much, then the care coordinator can help you identify another provider, another specialist within the plan's network. The reason why you can continue to see your doctor with the program CalMedi Connect, even though your doctor is not part of the program, is continuity of care. We don't want to say, well, you joined CalMedi Connect, your doctor is not in the plan, we're going to switch you to another doctor. It doesn't work that way. Is continuity of care very important, that you continue to receive the same quality of care while your doctor decides whether or not to join the network. And if he does, great. And if he doesn't, then your care coordinator can help you identify other doctors that are part of the network. Another important aspect of CalMedi Connect is that it doesn't change your in-home supportive services or nursing facilities. You as the patient, as the beneficiary, continue to keep the right to fire or hire your IHSS in-home services and supports providers and the hours. You keep the amount of hours that you were granted when you join CalMedi Connect. If you are in a nursing home, you can stay there as long as the nursing home meets the quality and safety standards. So if you wish to move into your own home or a family member's home, CalMedi Connect can help you get the services you need to continue to stay there in a safe manner. This slide is very important. If you have both Medicare and Medi-Cal, you should never receive a bill for any of your medical services. If you do, this is called improper billing, sometimes called balance billing. It is illegal under the state and federal laws. You may not have to pay it. There's actually two exceptions where if you are a Medicare Medi-Cal recipient and receive a bill, the only exceptions where you would have to pay it is that there is a medicine co-payments, drug co-payments, or you have a Medi-Cal share of cost. If you receive a bill, the first thing is to please contact your plan and tell them I got a bill. Again, you may not have to pay it, but don't ignore it because then the situation elevates and it gets worse. So call your plan and they can help you navigate the system. Oh, my screen froze, my apologies. Oh my, okay. Give me 1 second. Can you see my screen?
Yes, we see the slide. It says how to join CalMedi Connect. Here are 4 things you need to know.
Perfect. Thank you. Thank you so much. My apologies. So how to join CalMedi Connect? Again, as I've mentioned to you, find the plans that are available in your area that are part of the network, and then find out if your doctor belongs to the network. If not, ask them to join. Also find out where you would get your prescriptions and medical supplies and the equipment, if there's any equipment, special equipment that you are using. And if a CalMedi Connect plan meets all or most of your needs, you can join by calling Healthcare Options at that number on your screen, or you can also call the plan directly. Perfect. The beauty of CalMedi Connect is that there is no specific enrollment period. You can enroll at any time during the year. If you are new to Medi-Cal or new to a county, CCI is Coordinated Care Initiative County, when you first qualify, you will receive this booklet that you see on your screen. And it will ask you to choose a managed health care plan within a certain time frame. You can join CalMedi Connect then, or choose another option. And then you can switch your plan. So let's say that you select plan A with CalMedi Connect and you're not happy with it, you can change to another plan. In LA County, these are the plans and the phone numbers, and I'm gonna have this information in my booth. So I invite you to visit my CalMedi Connect booth, and all this information is there so that you, if you don't have a pen handy, all this information is gonna be at my booth. These are the plans in LA County. In Orange County, it's CalOptima. The Inland Empire, which is Riverside and San Bernardino, we have 2 health plans that are part of the CalMedi Connect. In San Diego. So these are the plans in the that are available in the 5 counties where this plan is being implemented. Now, what do you do if you have Medicare and Medi-Cal, but you don't want to enroll in CalMedi Connect? You don't have to. However, you have to select a Medi-Cal plan. And if you have Medi-Cal, you're probably already with a Medi-Cal plan. So this is important so that you continue to get your Medi-Cal services under your Medi-Cal plan. Again, these are the plans for Medi-Cal in the network of CalMedi Connect. Orange County, Inland Empire, San Diego. And the last option, really quick, I'm running out of time, my apologies. The last option is the PACE plan, the Program for All-Inclusive Care for the Elderly. So this program, it coordinates your medical care for people that are 55 or older with certain chronic illnesses or disabilities. And this program helps them live independently as much as possible in their home and in their community. To join a PACE health plan, you must reside in a zip code where the plan is being offered, and you have to meet that requirement of having a chronic illness. And whatever may be a chronic illness for me, it may not qualify as one of the requirements. So I invite you to visit my booth again to get more information on the different PACE programs that are available in your area. Again, LA, Orange County, Inland Empire, San Diego. And a summary, you have 3 choices under the Coordinated Care Initiative. You have the CalMedi Connect, you have the Medi-Cal Managed Care Plan, Medi-Cal plan with the original Medicare, and the PACE program. It does not cost anything to join or switch plans, and you will not lose your in-home services and supports or nursing facility benefits when you join CalMedi Connect. These are some important numbers. Again, I invite you to visit my booth. I will have this information there for you to download. And that's the end of my presentation. I'm Rita. My phone number and my email are on your screen, but I will also have that at my booth of CalMedi Connect. And that ends my presentation. Toya, back to you.
Thank you, Rita. We actually don't really have time for questions. I see Mary has raised her hand, so we're going to allow the one question from Mary. So Mary, you can either unmute yourself or type it in the box.
Okay, great. Thank you. Can you hear me?
Yes.
Oh, great. I am a Lucera employee, LA County retiree, and we have what's called, I'm currently in Blue Cross. So we have what they call Advantage. How does that work with this program?
So it's a Medicare Advantage, right, that you have?
Yes. Yeah. Well, I'll be eligible for it at the end of this year. Yes.
So Mary, why don't we take this offline, because I don't want to give you a 2-second answer when it deserves
okay.
please visit my booth. My phone number is on my booth and my email, and I can chat with you. I can call you.
Thank you.
Absolutely. Toya?
Thank you. Okay, and again, please go to Cal Medi Connect if you have questions. Rita will be there. I believe she'll be there half of the day, and then they'll have another representative that will cover the booth for the latter part of the afternoon. And they'll be able to answer any questions, and all of their contact information is in the booth, email, phone number, and you can reach out to them directly. So thank you all. This has been a great kickoff to our day, and we do have our next presentation beginning in about 7 minutes. We have Dr. Schultz Castillo. She's going to be discussing breast cancer. So thank you all for joining us, and we'll see you soon.
Thank you. Thank you, Toya. Bye-bye.
Bye-bye.